You are listening to the Maitri podcast between friends, conversations with Maitri. And this is your host, Nandini Ray. Hope all of you are doing great today. And this is a beautiful winter morning, and I have a beautiful guest with me. She is not only beautiful outside, but inside as well. A couple of weeks back, one of our board members, Sonia Pelia, shared an article with me about Dr. Anita Ravi. I came to know that Dr. Anita runs an unusual clinic dedicated to treating women who have endured intimate partner violence, sexual violence, and human trafficking. And after I read that article, I thought we must share her work on our podcast. This kind of news can motivate others to think differently and to do something new to help survivors of domestic violence, sexual assault, and human trafficking. So here is Dr. Anita Ravi. So Dr. Anita, thank you so much for taking time and coming to our show.
Of course. I thank you for creating this platform and giving me the opportunity to share and talk more. I appreciate it so much. So thank you.
Thank you. Before we start our conversation, let me introduce Dr. Anita Ravi. Dr. Anita is the CEO and co-founder of Purple Health Foundation, a nonprofit transforming healthcare for survivors of gender-based violence through comprehensive healthcare research and economic opportunity. She is a board certified family medicine physician, public health scientist, and nationally recognized expert in the areas of gender based violence and trauma informed care. Dr. Ravi regularly teaches, writes, and draws about how the healthcare system must radically change to meet the needs of people who have been historically marginalized. Dr. Ravi holds a master's in public health from Yale University and a master's in health policy research from the University of Pennsylvania School of Medicine. So, Dr. Ravi, I'm so curious to know, and I think our audience are curious to know about your organization, Purple Health Foundation. Why and how did you start this organization?
Yeah, sure. So let's see. I started back in 2015. I started this clinic called the Purple Clinic. And I started it, I had just finished my family medicine residency training in New York City. And, a lot of my work, I went into family medicine because I really wanted to work with women who had experienced domestic violence or other forms of trauma and were also experiencing social trauma that comes with it, whether it's incarceration, whether it's the immigration process, things that really impact people's health, but we never acknowledge it as such, typically in the healthcare system.
Yes.
And so I had done a lot of volunteering work at the Rikers Island jail in New York City. And back in 2015, I did a project where I was interviewing survivors of sex trafficking who were incarcerated on Rikers Island, asking them about their healthcare experience while they were being trafficked and any advice that they had about what would make them feel comfortable engaging in healthcare when they really needed it. And so I learned so much from people who had lived those experiences. And it really highlighted the deficits in our healthcare system and how, you can talk about it all the time. We have a free clinic for this, we have XYZ clinic for that. But when it comes down to it, the healthcare that people receive there just sometimes doesn't meet the standard of care that they need or that they may feel comfortable articulating the need for. And so, because of the interviews and because of what a lot of community-based organizations told me, I went to a community health center and I asked if I could pilot this clinic called Purple Clinic, where I would just be the family medicine doctor for survivors. And that means, care beyond violence or trauma, right? That's like one part of someone's identity potentially, but it also means that people might have like a breast mass that they're afraid to ask someone about that's growing and they don't know if they can see a doctor or not. They might have diabetes that runs in the family and they don't know if they have it. Like there's so much that comes with healthcare for a survivor or not. And so being able to create a space where it's normal to receive healthcare and to have someone who understands that there might be a history of trauma or might still be going on, and that that's okay, and that's also part of your healthcare, and we can figure out what you need based on, you know, whatever it is that you're experiencing or have experienced. And so I ran that clinic for about 4 years, and I took care of over 200 patients, but I think the sad part is from the community, we had over like 700 referrals. And I think when you first started something like this, you know, people were like, I don't know if anyone's going to come in. We don't know if there's a need. But then I think it's sadder sometimes to realize that there's a wait list, and that there's a lot of people who, if you design care in a certain way, would feel much more comfortable accessing care that they need. And so I took a step back in 2019, thinking about this clinic that I had built inside of a larger system. And there were so many things that I felt so strongly we could be doing better.
Mhm.
And we could do an even better job building something that reflects what people said they would feel comfortable with. And so I took a step back and I decided to end this Purple Clinic pilot that I had been running, and to think even more boldly, and to think about creating, you know, this kind of independent healthcare practice of create a model of care that hasn't been done, that can do it in a way that I feel good about at night when I go to bed, that I know that I did everything I could with the person that I was working with, and that it wasn't because what insurance told me to do, or it wasn't because a certain guideline told me to do something. Like I can do what I can with the best that someone has shared with me, or what my clinical instinct is, without any kind of third party worries. And that's what Purple Health Foundation is. So I co-founded it with my colleague Jessica, who is a therapist, and one of my former patients, Keisha, is currently our survivor leader care navigator in the practice. And we created this medical practice called Purple Family Health, and it works closely with Purple Health Foundation, our nonprofit. And we work together to provide free care for survivors. We don't take insurance. Of course, if patients have insurance, that's great. They're able to use it if they have labs or imaging or other things that they need. But if there is a copay involved, we do our best as a nonprofit to be able to cover the cost of that copay, so that survivors don't have to worry about medical debt or having to choose between getting food for the family or getting this necessary healthcare, big piece of their healthcare. We kind of try to make the decision easier for them by investing in people's health, so that we're investing in them long-term, kind of beyond episodic care. So that's kind of the long answer
Oh,
of
this is a
what
bold step. This is a bold step indeed. I mean, probably you are sharing within 2 minutes, but I can imagine the work behind, the mammoth of work behind your foundation. And I love the name where you write L and E in capital letter, like listen and engage. I was reading somewhere, it says listen and engage, and I love it. And so how do your clinic, Purple Family Health and Purple Health Foundation complement each other?
Yeah, so Purple Health Foundation, we are the nonprofit arm, and so we help fund the medical practice. And we also have a care navigation. It's called the Survivor Health Investment Program, the Purple Ship program. And so that has care navigation. So Purple Family Health is the medical practice. So that's me as the physician, and I do the medical care. And then Jessica is our director of mental health and social work, and she does mental health and therapy. Right now, the way that I think about our work is we're kind of in the early phase, right? We're a small team. We're building out this concept. We decided we are going to limit, in our first year, we're only seeing 15 patients. We know, obviously, from the work that I had done before, that the need is like at least 20 times that. But like right now we're keeping it small so that we can figure out all of these small things that we could do better to really enhance care for patients in a world where, if you believe that healthcare is a fundamental human right, what is the cost of that? and what are the payoffs from it? So it might be like, oh my God, you guys are going to pay for their labs if they can't afford it. They're going to pay for a specialist. Like, is that even feasible? But think about it. Like, maybe that money is saving people from being reincarcerated or being homeless again, because now instead of paying for a lab bill, they could pay for rent. So like, that's the way we're trying to think through the work that we're doing. And so the two organizations work together to think about people's physical, mental, and financial health throughout the kind of the longevity of their life, and not just, in crises, but wellness and crises and everything in between.
You said a small group, a small team is doing this work, but I'm seeing probably a small team, but it's a very powerful, big, powerful, team doing a big, powerful work. And kudos to you and your team. Hope you get everything to continue your work and to enhance whatever your dream, just make your dream successful. So one thing I was kind of thinking that domestic violence, sexual assault, they are, I mean, you also know that they are taboo topics in our community. And most of us even don't know that uh, most of us don't have enough education and awareness to identify abuse in our relationships, or um, women are either scared to talk about their abusive partner, or don't know about the resources that can help, or they're so trained by harmful patriarchal condition norms that they don't talk about this issue. And many times abusers are in the same room when doctors are examining patient. And statistics show that during pregnancy, abuse can get increased, and it's very difficult for even medical professionals to find out what is going on. So how do you recognize signs of abuse when women are not even ready to talk about their abuse, or not ready to disclose that they are survivors or victims? And how do you start the conversation with your patient to find out their situation, the real story? So that, I think if you have any strategy, then other medical professionals should be able to learn from that.
Yeah, that's a really great question. I think one of the one of the things that can be challenging but also important is understanding that um, every every patient that we work with is every human, right, is so unique in the ways in which we figure out how to communicate and how to understand what people are communicating. And so I say that because I think so often physicians are trained, hey, ask these 3 questions to figure out it's a domestic violence screener, ask them if they're safe at home, check this box on the electronic medical record. But we don't actually get trained on how to ask the question. There's a difference if you're looking at the computer screen and you're not looking at the individual in front of you and you're saying, okay, are you safe at home? Okay. As opposed to kind of looking at someone in the eye and like eye level, leaning forward and then asking like, hey, this is something we ask everyone, because sometimes people don't even know you could talk to your doctor about something like this. And, sometimes we ask these questions, it may not apply to you, but it may apply to someone that you know. And so we ask everyone so we don't miss anything. But are there times in which you're not feeling comfortable in the relationship that you're in, that you're having to do things that you don't feel comfortable doing? And I think what's so important is communication happens verbally and non-verbally, right? And I think we have to be open to understanding that people are going to communicate beyond words. So people might say, like, oh, everything's fine. But the way that they say it and who they look at and how they say it, those are things we have to be digesting and interpreting as well to understand kind of the full context of what's happening. And I think in all of these things, it's so important to recognize this, like the credentials of trust. Like every interaction I think of as a physician, like I have to earn or re-earn someone's trust. People, especially people sometimes when they have experienced abuse or violence, we tell if people are being sincere or authentic or not in terms of the conversation we're having and the help that's being offered. And so how could someone sometimes figure that out in one visit? It might take 7 visits before someone feels that you're somebody that they could open up to and share what's actually happening. And I think that that's so important, because I think physicians going beyond thinking like, did they disclose to me or not? Did I figure it out? It's more like, did I give them the information that they needed? Because maybe I'm not the person that they feel comfortable talking to about what's happening, but they went to the bathroom stall and they saw that the phone number was there, or that they know
Mhm.
that in the future they could tell someone, you can talk to your doctor about that. Like, that's actually a health issue. It's a medical problem. They'll take care of you. Like, there's just so much that's happening with each person that we're communicating with. And you raised some excellent points, right? Like, sometimes people are there at the visit with the abuser,
Mhm.
and there's like this dynamic there, especially if there's language interpretation involved, and especially in a healthcare system where people are like, they're rushing all the time and it's going to take too long to call the interpreter. So, oh, maybe this partner could just do the interpretation for them. Like,
Exactly.
like we don't, that is not the standard of care. But sometimes, because of all of the other pressures of the system, everyone's like, well, it's better than nothing, it's better than not being able to talk to them at all, and not thinking about kind of the invisible or hidden costs of some of these actions. And so I think just being open to recognizing, both from like a patient perspective, when I raise the issue, I can be in a different situation sometimes, because when I get referred patients from a community-based organization, the patient may have given consent for me to know about histories of trauma that they've had. I do
Mhm.
that so that they don't have to repeat it when they come in, because that in itself, having to retell your story multiple times, can be
Yeah.
traumatic in itself.
Re-traumatize you. Yeah.
Exactly. And so sometimes if there's an understanding that someone that they trust has relayed the information, and so I know it and we can kind of pick up, that can be helpful. For other people, I may know that there's a trauma history, but if I were to ask them about it, they may say like, nope, nothing's happened. And like, I know that there's a difference between like the history that I was given and what they're saying, but that's also completely okay. Like, you just have to be, I don't know, we're all just working towards a similar goal, right? Of being able to make sure people get
Yeah.
what they need. And however we get there is going to be a little different for everybody.
Yeah. We all have to be patient and, willing to find out the red flags and to do our work better, because in our culture, in our South Asian community, it is very normal to be, when women are seeing doctors, to their husbands or their partners, their mothers, they entered the same room. And it is possible that that women even forget about the vast history of violence or abuse. Even they have any personal question, they don't get sometimes opportunity to ask doctors those questions. They feel extremely uncomfortable in front of probably mother-in-law or mother. So I don't know, this is a lot of things we need to, as community members, we need to discuss, we need to focus on, to see if we can change something. It's not easy. It is very, very critical work, but at least some of us are trying. And violence against women is a social, economic, developmental, legal, educational, human right issue. So many aspects are attached to this issue. But it is also a healthcare issue, and most of the time we forget that it is a healthcare issue first, and it is because we can prevent morbidity and mortality of victims. So again, I want to thank you to take that issue so seriously and doing something to make that visible in medical fraternity. So did you face any hurdle, uh, any restriction, any hurdle, any roadblock in providing holistic support to survivor of domestic violence and sexual assault?
So definitely. And I'm just going to quickly circle back to an important point that you raised, because one thing that healthcare providers can do that I found helpful is if they are accompanied by someone. I always say in the beginning of the visit, like, oh, who is this? Okay, I just want you to know our clinic policy is that everyone, regardless, gets interviewed one-on-one. It's just how we do it. And sometimes I'll even put a sign on the wall that says like all patients seen one-on-one. So you kind of use the clinic policy as a reason for which you have that one-on-one time with somebody, even if they came with a mother-in-law, with a partner, whoever it is. Sometimes people are uncomfortable about that and you can read the situation, but as long as you can kind of push it on the policy, then I think sometimes there's a fear in families, right? Of like, they're going to talk about me. Like, what are they going to talk about? They've asked to see the doctor by themselves. Like, what is she going to say? But if you can say like, this is just how we do it. You can wait outside. As soon as we're done, I'll come and bring you back. There can be non-threatening ways in which to have that protected time. And even if the person has nothing to talk about, at least it becomes this norm. I think if people know that they have a right to one-on-one interactions and that clinics can also help support the norm of that, then we're working on both ends so people can actually, again, get that private confidential care that you're describing. And I would say the other thing that I worry about sometimes with COVID, especially in like South Asian families or like other families where we really live in like larger family units together, when we have things like telehealth visits, they're like, oh, you could just pop on and see your doctor. But sometimes like your whole family can be around. Like that's not as easy to access in the same way as it might be for other people. And so I just think that there's so many ways in which we can be both culturally sensitive and sensitive to violence and trauma and how we design systems and deliver that care. So
Yeah,
that's
and that is very difficult, right? You have to so much, it's a really tough balancing job. But yeah, as you said, we have to normalize the policy, like the rooming alone policy. Patient will be alone for some time in the
I
room.
asked
You about the roadblocks if you want to share anything.
yes. I mean, this whole, so yes, there's so much I'm learning. My background is as a physician and in public health. And so when I kind of stepped foot into the nonprofit world, it's been so interesting bridging this gap between, I think in the healthcare world of people recognizing that gender-based violence is a medical issue. And then in the nonprofit world of people realizing that the healthcare system doesn't have good solutions and might actually be re-traumatizing and harming survivors. And so I think making the case in both worlds has been more challenging than I expected. And, I think when it comes down to it, it's a balance between understanding the reality of what's there, but also seeing hope in it, right? So it's not just this negative thing that, oh my God, like we're missing all of these things. Yes, and like people need better systems, but imagine like if we actually did the right thing by people and if people could actually get what they needed, like our shared communities could be so much better. And I think that sometimes we don't always think of the solutions as having hope kind of beyond the immediate aspect of things, but I see how all of these things are so interconnected and all of us benefit from ensuring that like there's different ways in which we're preventing domestic violence and gender-based violence, even if it's already occurred, because recurrence is also an issue and there's just so much that we could do. I think that benefits everybody that we don't always see right away. And so the roadblock of making sure that people are aware and care and think that it's worth solving, so all those are every day. I'm always trying to think of new ways in which we can get people to care and be invested.
Yeah, and also I'm sure that you you wish you get enough funding.
Yeah, that's yes, but I firmly believe there must be people out there who are excited to be like, oh my God, yes, we should be doing healthcare differently for survivors, and they want to be part of how to design this better, and and maybe they'll want to fund us. So
yeah, I really wish that you get a lot of funding to do this good work. And as you said, then it is not easy. When some of my friends asked me that, how do you do this domestic violence advocacy work? Every day, don't you get tired? Don't you get you know frustrated? I tell them, yes, I get frustrated. I become sad, agitated, seeing our that seeing the survivors and victims. But at the same time, I feel so so good when I see our clients, Maitri clients who are survivors of domestic violence, they're getting back their self-esteem. They're standing on their feet. They're doing something productive. They're safe. They're happy. They're starting a new life. So that kind of good things, good examples give us a lot of strength and energy probably to keep going. So I totally can understand what you are saying, that whenever you see good things are happening, even in a small percentage, but compared to the big hurdle we are facing, but it's still enough, more than enough. And I firmly believe we will see more good outcome in future. So do you have any ask for your medical fraternity in the Bay Area?
Um, I think the Bay Area is doing, the Bay Area is always, I feel like, ahead of the curve in a lot of things, whether it's social issues, whether it's healthcare. But I think that for anyone, look, like right now, I'm practicing medicine in the way that I believe it was designed. And it was absolutely designed to put our patients first. And to really meet them where they at and hear what they need and do everything we can to create normalized systems for them to be able to access it with as little burden as possible.
Mhm.
And anybody that believes in that and is trying to do that work with their population, whether or not it includes survivors of domestic violence, like to me, I think there's so much I've learned by working with survivors that is improving healthcare for all. And I think anyone, especially if they are trying to work with survivors, um, and they feel alone in their system or they feel like they don't have the support, to please reach out because it is a lonely community. But I mean, I say this all the time, but I think that there are unicorns everywhere. There are these people in their systems, they're kind of traditional systems, and there are these people who just stand out for wanting to do something different and something right. And it can be really difficult to maintain that if you don't have the right kind of support. And I think the way that the movement is right now, we have to find each other. We find each other through these podcasts and through articles, so that we can keep each other up, to keep trying to do things in our own systems to make that change. So people, for physicians practicing in the Bay Area who have maybe worked with one survivor, where their dream job is to make exclusively working with survivors and investing in their health, like please reach out to Purple. Please, we can connect you with other people who are doing this work, and we're all learning from each other. So there may be things that some people are doing that haven't worked for other people or they didn't think about it. We should be sharing that stuff because that's the only way that all of us again are going to elevate care for everyone. So
Yeah,
I hope we're building a community through this work.
you
That
are
would be
so
great.
right. You are so right. We have to find each other. We have to complement each other in our work, and to uplift survivors' need, to amplify survivors' voice, so that we can together we can prevent domestic violence, sexual assault, human trafficking. Together we can help survivors. So thank you, Anita, for sharing your thought with us. And so last question, do you have any ask to the community members if they can do anything, or any part to ask any policymakers for any policy change, anything you want to ask?
Our dream obviously is funding in this space, like understanding. I think people investing in understanding that the healthcare system can be thought of and dreamed of differently beyond what we're doing, and that it's worth it. And it's certainly worth it to learn and understand from the people who need care and are afraid to access it. Like that, every barrier that comes with that is something that we should identify and solve, because it's unacceptable to not be able to access healthcare that you need. So on a bigger philosophical level, I believe that strongly. I think, one thing that I've been thinking about a lot is just investing in even the research of this work.
Mm.
So I'll give you an example. Like often we're finding sometimes if women have had injuries, like head injuries or other things as part of their violence, like sometimes that can impact how their decision-making function works, like their cognitive impairment, how their brain function is. But
Mm,
sometimes like these things get invisibilized or masked. And so often some just women blame themselves, or they'd be like, oh, I'm so forgetful. I don't know
mm,
why, or I just lose my temper. But there may be other things that are contributing to it that are related to the violence and other issues that they've had. And there just isn't a great, we aren't studying that aspect enough of whether it's traumatic brain injury or cognitive dysfunction. I see that in my patients peripherally, but we don't quite have the infrastructure in place, I think, in across many medical clinics to be able to really understand, is there an aspect of domestic violence in healthcare that we're just missing, that's invisible, like a whole other set of diagnoses or things that could actually elevate care again for survivors in a way that we just haven't even been thinking of. And so I think it would be really great for, from an administration perspective or policy perspective, to really look at funding healthcare at this intersection of domestic violence and healthcare, and looking at what these outcomes look like for survivors and what are we missing, what are we not, especially when it comes to things like traumatic brain injury.
We need a lot of education, awareness, conversation like this on this topic so that we can, one day we can change the culture and we can do more work. And it is sometimes it's very upsetting that our world has entered into a new millennium, but from the dawn of civilization till date, the women of in patriarchal society have been facing discrimination, oppression. So I don't know when it is gonna end, but on the other hand, when I get upset, frustrated, I see that a lot of good work is happening around us, and that gives us motivation to do more work. And I'm sure one day we will have a safe and healthy society for all of us, for all genders, for all of us. So thank you so much, Dr. Anita, coming to our show and sharing your wealth of knowledge and experience with us. I'm sure your work will motivate thousands of medical professionals out there. I hope they will also do their best to help survivors. So thank you.
Thank you for this opportunity. Your organization and your work is also inspiring and it keeps us motivated. So thank you so much for making this opportunity happen and for letting us share. Thank you.
Yes, and thank you. And survivors, advocates, and medical professionals alone cannot end DV, sexual assault, or human trafficking. All community members, we all have to play a crucial role in helping victims heal and take the next steps in their lives. Also, we all should take part in changing culture that allows violence against women, domestic violence, sexual assault, human trafficking. So, I'm ending this episode with a lot of hope that we will be able to do our work and we will engage more people with us. So, thank you, Anita. And this is your host, Nandini Ray. Before I sign off today, I just want to send out a message loud and clear that if anyone is abused by someone they trusted or loved, then it is never victim's fault, and no one deserves to suffer in silence. Help is out there. Please call your local agencies that support survivors of domestic violence, sexual assault, and human trafficking. Call Maitri helpline to find out resources and options. Maitri helpline number is 1-888-862-4874. Again, 1-888-862-4874. All phone calls and all Maitri services are free and confidential. Thank you for being with us, listening to this show, and keep listening to and sharing Maitri podcast. You never know, you will probably save someone's life with sharing the information and stories that we share on our podcast. Um, Thank you. This project was made possible by funding provided by Santa Clara County Office of Gender-Based Violence Prevention.
This show is for informational purposes only and is not to be construed as legal advice. Always consult an attorney for legal advice. Views expressed by guests of the radio show are individual opinions and not endorsed by Maitri.
Maitri is a free, confidential, nonprofit organization based in the San Francisco Bay Area that helps families and individuals facing domestic violence. Don't suffer in silence. Call Maitri Helpline 1-888-8 Maitri, Maitri. Visit our website maitri.org.